What's happening, gentlemen? Dr. James Whittaker here, and today we need to have one of the most important conversations that most men actively avoid. We're going to talk about penile cancer, specifically the three critical warning levels that every man needs to recognize before it's too late. Before we dive in, make sure to hit that subscribe button and ring the notification bell, because what I'm about to share could literally save your life or the life of someone you care about. I know this topic makes most men uncomfortable. I get it. But here's the reality. Penile cancer, while relatively rare, is one of those conditions where early detection makes an enormous difference between a simple treatment and a life-altering outcome. Just last month, I had a 62-year-old patient named Robert come into my office. He'd been ignoring a small growth on his penis for over 8 months because he was too embarrassed to mention it. "Dr. Whittaker," he said, barely making eye contact, "I kept thinking it would just go away. I didn't want to bother anyone with something so personal." By the time Robert came to see me, what could have been treated with a simple procedure had progressed to a point requiring much more aggressive intervention. This is why I'm making this video today, because silence and embarrassment are literally killing men who could have been easily treated if they'd just known what to look for. Today I'm going to walk you through the three levels of penile cancer warning signs, from the earliest indicators that are often completely harmless but need monitoring, to the advanced signs that require immediate medical attention. By the end of this video, you'll know exactly what to look for, when to worry, and most importantly, when to take action that could save your life. Let me know in the comments below. Have you ever delayed seeing a doctor about something because of embarrassment? You're not alone, and today we're changing that. Before we dive into the three warning levels, let's quickly establish what penile cancer actually is. Penile cancer occurs when malignant cells form in the tissues of the penis, most commonly on the glands, head, or foreskin. While it's relatively rare in developed countries, accounting for less than 1% of cancers in men, the incidence increases significantly with age, particularly after 60. And here's the critical point. When caught early, the 5-year survival rate is over 85%. When caught late, that number drops dramatically. The most common type is squamous cell carcinoma, which develops from the flat skin cells. Risk factors include HPV infection, smoking, poor hygiene, chronic inflammation, and not being circumcised, though circumcision itself doesn't eliminate risk entirely. Now let's break down the three warning levels every man needs to understand. Level 1. The early warning signs. Don't ignore these. Level 1 represents the earliest indicators, changes that might seem minor or even harmless, but that deserve your attention and monitoring. These are the signs that, if caught and addressed at this stage, often lead to the best possible outcomes. Warning sign 1A. Persistent skin changes on the glands or foreskin. This might appear as a small area of thickened, discolored skin, often white, red, or slightly brownish. It might look like a small patch of rough or velvety skin that doesn't match the surrounding tissue. Many men dismiss this as irritation or minor skin damage, but persistent changes that last more than 4 weeks, especially if they're not responding to normal hygiene or over-the-counter treatments, warrant a doctor's evaluation. Warning sign 1B. Small, painless lumps or bumps. A tiny firm growth or bump on the shaft, glands, or under the foreskin that doesn't hurt but also doesn't go away. These can be flesh-colored, white, or slightly pink. The key word here is persistent. A temporary bump from minor trauma or irritation is normal, but anything that remains unchanged or grows slowly over several weeks needs professional assessment. Warning sign 1C. Changes in skin texture. Areas of skin that feel different, perhaps crusty, scaly, or unusually smooth compared to surrounding tissue. This might resemble a patch of eczema or psoriasis, but in a location where you've never had skin problems before. Warning sign 1D. Persistent redness or irritation. Redness that doesn't respond to improved hygiene, that keeps returning, or that slowly spreads over weeks. This is particularly concerning if it's accompanied by any thickening of the skin. Warning sign 1E. unusual discharge or odor. While not always cancer-related, persistent unusual discharge, particularly if bloody or foul-smelling, that's not explained by infection needs evaluation. At level 1, many of these signs can be completely benign. They might be simple skin conditions, warts, or other non-cancerous growths. But the critical message is this: don't wait and hope they disappear. Get them checked. At this stage, diagnosis is straightforward, treatment is usually simple, and outcomes are excellent. Level 2 represents progression. These are signs that indicate something more serious is happening and that immediate medical evaluation is essential. Not next month, not when it's more convenient, but now. Warning sign 2A, a growing sore or ulcer that won't heal. This is one of the most common presentations of penile cancer. It starts as a small sore, similar to what you might get from minor trauma. But instead of healing within a week or two, it persists. It may bleed easily when touched, develop a crusty surface, or begin to expand slowly. Any sore on the penis that hasn't healed after 3 weeks needs immediate medical attention. This is not a wait-and-see situation. Warning sign 2B, a lump or mass that's noticeably growing. At level 1, we talked about small, stable bumps. At level 2, we're talking about growths that you can clearly observe getting larger over weeks. These might feel firm or hard, maybe painless or slightly tender, and might begin to change the shape or contour of the affected area. Warning sign 2C, changes in the color of skin with texture. Changes. Skin that's becoming noticeably darker, redder, or developing a mottled appearance, especially if combined with thickening or a change in how the skin feels. This might look like a bruise that never fades or a dark patch that's slowly expanding. Warning sign 2D, bleeding that's not from obvious trauma. Any unexplained bleeding from the penis, whether it's from a growth, a sore, or just seems to come from the skin itself, is a red flag. This isn't bleeding from vigorous activity or minor injury. This is spontaneous or easily triggered bleeding. Warning sign 2E, foul-smelling discharge from under the foreskin. While discharge can occur with infections, persistent foul-smelling discharge, particularly if accompanied by any of the other level 2 signs, can indicate tissue breakdown associated with cancer. Warning sign 2F, difficulty or pain retracting the foreskin if uncircumcised. New onset phimosis, inability to pull back the foreskin, in adult men, especially if accompanied by inflammation or thickening, can be associated with underlying malignancy. At level 2, time is of the essence. These signs indicate that something significant is happening that requires professional diagnosis and likely treatment. The good news is that even at this stage, when addressed promptly, outcomes are generally very good. But delay at this level can allow progression to level 3, where things become much more serious. Level 3 represents advanced disease. These are signs that cancer has likely progressed significantly and possibly begun to spread. These situations require immediate emergency medical evaluation. Warning sign 3A, a large fungating mass. A significant growth that may be ulcerated, bleeding, and has an obviously abnormal appearance. These growths can be painful, produce discharge, and may have a very unpleasant odor due to tissue breakdown. Warning sign 3B, significant swelling of the penis or surrounding area. Marked swelling that's not from obvious trauma or infection, particularly if it's progressive and doesn't respond to standard treatments. This can indicate tumor growth or lymphatic obstruction. Warning sign 3C, enlarged hard lymph nodes in the groin. Lymph nodes are part of your immune system, located in your groin area. If these become noticeably enlarged, hard, and don't shrink after a couple of weeks, it can indicate that cancer has spread to the lymphatic system. Feel your groin area. If you notice lumps that feel like firm beans or marbles under the skin, especially if they're not tender and don't move easily, this requires immediate evaluation. Warning sign 3D, persistent pain in the penis or pelvis. While early penile cancer is often painless, advanced disease can cause significant pain. Persistent pain that's not explained by injury or infection, particularly if accompanied by any other warning signs, needs urgent assessment. Warning sign 3E, systemic symptoms. Unexplained weight loss, persistent fatigue, loss of appetite, or night sweats combined with any penile changes can indicate advanced disease that's affecting your overall health. Warning sign 3F, difficulty urinating or blood in urine. If the cancer has grown to affect the urethra, the tube that carries urine, you might experience difficulty urinating, a weak stream, or visible blood in your urine. At level 3, we're talking about a medical emergency. These signs indicate that cancer has likely progressed significantly and time is critical. Treatment at this stage is more complex, may involve surgery, radiation, chemotherapy, or combinations of these approaches. But here's the crucial message. Even at level 3, treatment is possible and outcomes can still be positive, but only if you take action immediately. Understanding your personal risk factors helps you know how vigilant you need to be about monitoring changes. High risk factors. Age over 60, HPV infection, particularly types 16 and 18, smoking or tobacco use, phimosis, tight foreskin that can't retract, poor genital hygiene, chronic inflammation or repeated infections, conditions like lichen sclerosis, treatment with UV light for psoriasis, being uncircumcised, though circumcision doesn't eliminate risk. If you have multiple risk factors, you should be particularly attentive to any changes and maintain regular checkups with your healthcare provider. While not all cases can be prevented, there are clear steps every man can take to reduce risk and catch problems early. Maintain excellent genital hygiene. Regular thorough cleaning of the entire genital area, including under the foreskin if uncircumcised. This isn't complicated, just regular washing with mild soap and water. Don't smoke. Smoking significantly increases risk of penile cancer, as well as virtually every other cancer. If you smoke, quitting is one of the most powerful health decisions you can make. Practice safe sex. Using condoms reduces exposure to HPV, which is associated with a significant portion of penile cancers. Consider HPV vaccination. While typically given to younger people, the HPV vaccine can provide protection even for older men who haven't been exposed to certain strains. Address phimosis. If you have a tight foreskin that's difficult or impossible to retract, discuss treatment options with your doctor. This condition increases cancer risk and makes proper hygiene difficult. Early detection strategy. 1. Regular self-examination. Once a month in good lighting, thoroughly examine your entire penis, the shaft, glands, foreskin, and base. Look for any changes in color, texture, lumps, or sores. If you notice anything new or changing, document it and monitor it closely. Early detection strategy. 2. Don't ignore persistent changes. Any change that persists longer than 4 weeks deserves medical evaluation. Don't talk yourself out of seeing a doctor because of embarrassment. Strategy 3. Regular medical checkups. Your annual physical should include discussion of any genital concerns. Be honest with your doctor. They've seen everything, and early detection could save your life. Let's address the elephant in the room. Why do so many men delay seeking help for penile concerns? Embarrassment, fear, denial, the hope that it will just go away. Cultural taboos about discussing private parts. But here's the truth. Doctors are medical professionals who examine genitals regularly as part of their job. What feels intensely personal and embarrassing to you is routine anatomy to them. Remember Robert from the beginning of this video? After his treatment, he told me, the 5 minutes of embarrassment during that first appointment would have saved me months of worry and much more invasive treatment. I wish I'd come in the moment I noticed something wrong. Your life and quality of life are worth more than temporary embarrassment. To make this crystal clear, here are the simple rules about when to seek medical evaluation. See your doctor within 1 to 2 weeks if you notice any persistent skin changes lasting more than 4 weeks, You discover a new lump or bump that doesn't go away. You have persistent redness or irritation that doesn't respond to improved hygiene. See your doctor within 2-3 days if you have a sore that won't heal after 3 weeks. You notice any growth that's getting larger. You experience unexplained bleeding. You develop difficulty retracting your foreskin. Seek immediate medical attention. You have a large or rapidly growing mass. You notice significantly enlarged lymph nodes in your groin. You experience persistent pain in your penis or pelvis. You have difficulty urinating or blood in your urine. You have any level 3 warning signs. Penile cancer is one of those conditions where knowledge and early action make all the difference. The 3 levels I've outlined today give you a framework for understanding what to look for and when to take action. Level 1 signs might be nothing serious, but they deserve monitoring and evaluation. Level 2 signs require prompt medical attention. Level 3 signs require immediate emergency care. The 5-year survival rate for penile cancer caught at stage 1 is over 85%. For cancer that's spread to distant parts of the body, that number drops to around 11%. The difference between those numbers is early detection and action. Remember, Robert, after his treatment, he made it his personal mission to tell every man he knew, "Don't be like me. Don't wait. Your life is worth more than your embarrassment." Your body gives you warning signs for a reason. Pay attention to them. Trust your instincts. If something doesn't seem right, get it checked. If you found this information valuable, please hit that subscribe button and share this video. This is information that could save someone's life, but only if they have access to it. Drop a comment below and let me know what country you're watching from. And if this video gave you information you needed, just type the number 1. Your feedback helps me create content that truly serves you. Until next time, this is Dr. James Whittaker reminding you that your health is your most valuable asset. Protect it, monitor it, and never let embarrassment prevent you from seeking the care you need. Stay strong, stay vigilant, and take care of yourselves, gentlemen.